Hey guys, it's Dr. Ryan here, and I wanted to talk to you a little bit about something that's happening more and more in my office that's a little frustrating. Patients are coming in asking for thread lifts, and they're convinced, they're sold that thread lift is the thing for them. I'm not a big fan, and there's a lot of reasons why, so I thought I'd share that with you right now and share with you what happens in my consultation room when a patient comes in asking for a thread lift. I explained to them that there are two basic kinds of thread lifts. One that was popularized 10 plus years ago and it's kind of faded away. Those are threads with barbs, things that stick out of a suture like this opposing, and we would go in, I've never been a fan, but surgeon would go in one way and the other way with the barbs and tighten up, and these barbs would lock the tissue and kind of create a pull like this. I can't say I've ever seen a thread lift that looks natural, and to make things worse, they kind of unravel unpredictably, can break, and never have the right kind of support of the face that's to look natural. You can imagine also, the more you tighten, the more loose skin there has to be somewhere. So those aren't really advisable. What's happened in industry now, because of the demand for these magical procedures, is that thread lifts have come out that have no barbs. What that means is the surgeon is simply inserting sutures underneath the skin in a cross-hatched pattern. Now, the promise is great from a business perspective. We do this procedure, in 8 months to a year, you're going to see some effect. So you pay the money for the procedure, you get it done, you walk out, and well, that's that. Now, the theory behind it is that these sutures like we use in every surgery, cause scarring, and the scarring will contract. I ask you, why do you want scar on your face? I don't want scar on my patients' faces. In surgery in general, we try to minimize suture burden. That means that we think carefully where we place sutures and don't place too many because they all make scar. I try to get thread lift patients converted to what I call aesthetic facial balancing, or a procedure that will actually deliver. When we age, we lose volume and we get elasticity loss in our face. You can see, like in this patient has been treated with a lot of non-invasive things, including silicone in her lips and an improper rhinoplasty, but by treating her with volume and no surgery, we can really get that lifted and pretty appearance. Thread lifts won't deliver this. The threads can extrude and cause all kinds of problems. So from Dr. Ryan, I say stay away from thread lifts. If you want an intervention that works, think of volumetric intervention and look at people that use fat, surgery, and fillers and have great results. That's the kind of person that can guide you to the right procedure for you. So the tip for today, no thread lifts.